Hello, everyone. Welcome to the Natural Diabetes Reversal Program. I'm Dr. Jeremy Lamb, and please find a comfortable seat, a pen and paper. We're going to be going through a lot of information and grab your water if you have it here, and let's get ready for our webinar. So, let's start with some shocking statistics first. 1 out of 10 adults in the world have diabetes, and really half of diabetes cases are undiagnosed. 1 in 3 Americans have prediabetes, so that's really 96 million of adults, and yet most of us don't know about it. 5 seconds, every 5 seconds, someone really dies from diabetes. And ultimately, in 1800s, we were consuming 2 pounds of sugar, and now it's really 152 pounds per year. So something is not going right? We're trending in the wrong direction. And clearly, conventional medicine does not have the answer. And so we're going to really dive deeper today to figure out why this is going on. So I see a lot of California's, Union City, Rowan Heights, Beaumont, Fountain Valley. Great, great. Thanks for seeing here. We have people from all over. And that's the beauty really of this webinar is we're able to educate everyone just in the comfort of your own home that way. So at the end of this webinar, my goal for you is to ultimately learn the real root cause of diabetes, why medications for diabetes won't cure it, and really how to naturally reverse diabetes. And so, really, this webinar is for those who have been told really that you have prediabetes, type 2 diabetes, you're frustrated with medications that aren't solving the problem, you're stubborn with the belly fat that just go away, you feel tired all the time, you have brain fog, and you're really scared of the complications of all the issues that come with diabetes. And ultimately, if you're really ready to find a better way to take control of your health. And so ultimately, I want to commend everyone here for really being action takers because you guys want to take action on your health. You want to feel better. You want to get down to the root cause. So you've already taken the first step in addressing and trending in the right direction. So who am I? I'm actually an internal medicine doctor by training, and ultimately, I also got anti-aging, regenerative, and functional medicine training. Ultimately, I was just a doctor who was giving out medications just like all these other conventional doctors. I was giving out metformin, statins, insulin to all of my patients. And the patient's sugars and cholesterol would actually come down temporarily. But they still came back to me because their weight would go up. I would need to keep going up on their metformin dose or their insulin dose. And ultimately, patients were still getting neuropathy, even though I was having control of their blood sugar. And so I kept asking my question, why is this going on? Why are we having to keep adding medications and yet there were still complications? What was really the underlying root cause? Is it really just sugar? I've seen so many patients who say, hey, I've cut out my sugar, I've cut out my carbs, and yet I can get my A1C lower. And so there has to be a reason why. And your body's sending out these signals for a reason. We just have to ask the question why and address it. And so me myself, actually, I have a strong family history of actually diabetes. My grandmother had diabetes, my dad has diabetes, and I was actually trending in that direction as well. I will show you guys my A1C. So really, I decided to further my education and figure out and ask the question why. So I spent actually 4 years getting board certified in regenerative medicine, spent another 2 years in getting functional medicine trained, and ultimately really just getting the knowledge to be able to help patients out and also help myself out. So this was actually my A1C here. It was 5.5 on the right and actually trended down to 5.3 after I started practicing some things. But that was also one of my caveats about really A1C, right? If you guys know A1C, 6.5 and above means you're diabetic. 5.7 and above means you're pre-diabetic. 5.5, I'm already trending in that direction. So I really didn't like how conventional medicine approached diabetes because let's say A1C of 6.5 means you're pre-diabetic. If you're 6.4, does that mean you're not diabetic? Does that mean that your body is not being resistant to the sugar? Even in my case of 5.5, I can already tell that my body was becoming more insulin resistant. So ultimately, we have to take a personalized approach to figuring out these labs and not just say a one size fit all. Just because your A1C is 6.4, that means I'm not going to treat you. I'm not going to get you on medications that way. So it's really an individualized approach. One of the show actually, this other patient here actually who we've been seeing for years, his A1C actually started at 6. He was actually much higher. He was actually on insulin, but I could only track back to 2024. And he's slowly come down, and we've actually been able to decrease his insulin need actually. It's 6, 5.5, 5.4, 5 point, and then actually in the 4.6. And this is already addressing things naturally, and we've been able to actually get him off of his insulin as well. So I definitely know it's a possibility if, again, we dive into these secrets on how to reverse diabetes, which I'm gonna go through.